friends, this is Bud Tarreto, naturopath and nutritional consultant for Capture Your Health. It's my pleasure to be your host for the Healthy Corner. Let me ask you a question. If the oil light was on in your car, would you hit it with a hammer to put out the light, or would you try to find the cause? You may be saying, Bud, that's a ridiculous question. But you know what? That is exactly what we are doing when we use a cholesterol-lowering medication. Whenever there is a crisis situation, cholesterol-lowering drugs can increase nitric oxide just for a short term, and a good thing. But for the most part, they can cause problems. Many of the cholesterol-lowering medications have side effects such as muscle weakness, reduced thyroid function, memory reduction, reduced immunity, depletion of beneficial nutrients like carnitine, CoQ10, zinc, selenium, vitamin E, and healthy lipids. All nutrients for efficient heart function. So what is all the buzz about cholesterol? We hear all the bad about cholesterol, but we need to know the importance of cholesterol. Cholesterol is a substance required for the normal function of cells. It is present in every cell of the human body. It is also found in the bloodstream. The soft, waxy substance is produced in the body and is essential for the production of vitamin D, bile salts, and hormones. What are the sources for cholesterol? The body creates most of the cholesterol found in the cells and blood. Very little comes from food. The liver is responsible for producing the cholesterol in the body. The liver can synthesize enough cholesterol to keep the cells healthy and hormones at the proper levels. The cell membranes need to allow elements such as oxygen and nutrients to enter and unwanted materials to be eliminated. Cholesterol is critical for cell membranes to function efficiently. Vitamin D is created in the body when sunlight hits the skin. If cholesterol is not present, this will not occur. Bile salts, which are created from cholesterol, play an important part in the absorption of fat in the digestive tract. And last but not least, cholesterol must be present in the body to create hormones such as progesterone, estrogen, cortisol, and testosterone. So you say, Bud, what is the buzzword about cholesterol? You go to the doctor, and the first item usually mentioned is cholesterol. Let's clarify what those lipids represent. Total cholesterol is broken down into two classes: HDL cholesterol, which has always been called the good guys, and the LDL cholesterol, deemed as the bad guys. What really creates the problem is the size of the HDL and LDL particles. There are 5 different sizes of each. The smaller LDL particles are the unhealthy particles. Simply put, if you have more large HDL particles, the healthier you will be. Here's where the challenge occurs. The small LDL particles become oxidized. It's like cutting an apple in half and it starts to turn brown. Also, these small LDL particles can become caramelized, which is known as glycosylation. These 2 risk factors will cause inflammation within the cell membranes. Therefore, if the cell membranes are healthy, there is no inflammation, and these particles pass through as they are needed by the body. How do we keep cell membranes healthy and prevent this from occurring? Number 1, increase factors that promote healthy vascular cell membrane function. Number 2, use nutrients that have been shown to affect particle size. In other words, the idea is to increase the size of HDL and HDL particles through nutritional support. And number 3, prevent LDL and HDL particles from becoming the oxidized and glycosylated forms. So it is important than just knowing your cholesterol numbers. Some things to remember. Avoid over-the-counter or outlet supplements and the one-size-fits-all approach. We at Capture Your Health can help you develop an individualized nutritional program for those who are on cholesterol-lowering medications. Please click on the information about our natural cholesterol-lowering product called LipidCert. This was developed by Dr. Mark Houston at Vanderbilt Medical Center. LipidCert addresses the threefold strategy we mentioned earlier in this video. LipidCert can enhance what you are already doing. If you are in doubt about cholesterol-lowering medications, LipidCert may be your answer. Enhance the body's ability to have cholesterol as an asset rather than a liability. This is Bud Tarreto for the Healthy Corner. May the blessing of good health be with you always.